happy to actually hear from a patient. The patient is not here with us today, but we have Sue McCutcheon who will be presenting on this patient's story. So I'd like to invite Sue. Sue is currently the lead for Access to Care, and she has been very instrumental here in the Southwest for us, particularly from the Senior Friendly Hospital perspective, supporting the work of Jillian and working closely with Jillian and championing Senior Friendly as well. So we do thank her for that. Sue began her career as a nurse at Victoria Hospital in London, eventually transitioning into leadership positions in hospitals and long-term care that provided her with new opportunities to make a difference in the lives of patients. Most recently, prior to joining Access to Care, Sue was Vice President of Clinical Service and Chief Nursing Officer at Grey Goose Health Services. Sue will be sharing with us the great work that Access to Care has been doing as well around patient-based experience, and sharing some excerpts from an interview that Jillian did with one of our patients. So join me in welcoming Sue.
Thank you so much to everybody for inviting me to come and speak. It's a real honor to speak on behalf of the patient, and it's also a big job because you want to make sure that you honor exactly what the patient was telling us. And so I'm just going to try and see if I can advance the slide here. Okay, I'm going to leave it on desk there. I'm not fiddling with it. Susan, some of you may recognize Susan because she was a patient here in the Southwest. She has given her full consent to share this story, and both her daughter and her were part of the interview. I would say up front that anything I'm going to say is directly from them. It is not from any medical chart or any interview with any of the staff or medical people that worked with Susan over her period of time. She did spend a month in the hospital not that long ago. She was brought in quite an acute phase with low blood pressure and high fever. Those are their words, her and her daughter. And her daughter said that she'd called the ambulance because her mom was delusional and had been struggling for a few days. And even though her mom didn't want to go to hospital, she made the call because of the confusion and called the hospital. And so she knew that she had some things going on when she knew she had pneumonia. She knew she had a bladder infection, and there were some other infections that she wasn't just quite sure about, but she had some infections that were happening, and she wanted to share, and why she agreed to the interview was to be able to share her experiences to help us get better at what we do. This is a very similar process. Kristen said that we've done this with our Access to Care work over the last couple of years, and really done what I would call in-depth interviews, very open-ended, so we let the patient fully tell their story. We only interject for clarification, and it's usually about an hour long. We transcribe these interviews and then analyze them for key messages that those patients can help us with from a system point of view. So that's the process that Susan and her daughter went through. Jillian was present for the interview, so I know she'll keep me honest. I've been the person who sort of looked at the transcript, listened to the interview, etc. So Jillian, if I say anything sideways, get me back on track. If there's one message that I came away with after listening to this interview was, as healthcare providers, we can never underestimate how important our communication with patients is and what an impact communication has on patients. And so I'll come back to that message, but I think that's the key one for me. Ooh, goodness. Good, really good. There. So I tried to put these in Susan's own words, but really what she started with, I need people to listen to what I want. And as a nurse, I would frame that, we need to work together and, develop patient goals. But her perception was that they weren't necessarily listening, that she really, really, really wanted to go home. Rightly or wrongly, that was her perception. And that she was feeling very isolated because she was frightened they were going to put her someplace. And a little bit more history about Susan to understand the context of that. She came to hospital with some functional deficits. And one of her worries when she was at home was that she might end up in long-term care. And so this episode only heightened that fear and anxiety for her. And so her only thing that she wanted was to go home. And then the next piece is really work with me, help me to get where I want to go. And so if she wanted to go home, what was it that particular team and Susan and her daughter needed to do together in order to get this person home? And those of you who've been working with me with Home First for a long time, that's a real key message that we work with teams all the time is what do we need to do together to help get you where you want to go? And in many cases that is home. And so for her, she thought a little more physio would have been helpful for her. Because of her natural functional deficit, it was difficult for her to do some of that functional mobility on her own, and she would have liked a little bit more help to do that. When she was in hospital, because of that functional deficit, she wasn't let out of bed on her own, and so she had felt that she was losing gains or losing her function, and actually having to learn to walk again. And the daughter really felt that this was impacting her ability to get home. And this is a piece, we all know this, we all work on this, we all want to say the same things across the whole team. And I would say in this place, everybody did except one. And so that was the piece that she focused on or picked up on. There was one team member who didn't necessarily have the same message, or she didn't feel that that team member had the same message. And so that whole piece about you can't go home until you get mobile, and yet she didn't think that anybody was helping her necessarily get mobile, right? And so she was feeling that disconnect. And then the other piece was about whether or not she was going home. So some team members were planning, or she felt were planning for her to go home and get better to go home, and some team members weren't. And so she was not understanding that disconnect. And again, this is about the communication piece. Again, her comment was it was really hard to stay positive through this month. And it wasn't that the care wasn't good. She said, my care was good. I liked the nurses. The doctors were good. I felt respected by most of the staff. So it was mostly positive experience. And yet, she was really worried, frightened and depressed. These are her words. Lost all hope that they're not going to let me out. And so that mental state really, really made her struggle. And for her, it was the positive communication that would have made the difference, or that's her perception. So if somebody could have been more encouraging, more positive towards that goal, she felt she could have got there. And then there's this piece about what do you do if you don't get better? And that wasn't a question that she was quite ready to deal with because she was still setting her goal at going home. I will tell you that Susan went home at the end of March. She's still at home. And she has her good days and her bad days. And her daughter is her caregiver at home. And she has some CCAC services, but limited. And is actually doing as well as she set her goals to do at home. So she is maintaining at home even through all of this. But I would just offer her plea, I think, about us thinking through our communication and what we say in supporting patients through this time of their